Pandemic brought on disagreement all the way up to our elected officials, and it continues to do so.
In the Unicam, LB 421 is one that senators' response to public mandates and protocols by rehiring local elected officials to approve them, not health officials.
Our Bella Caracta joins us with how this bill would reshape public health efforts.
Directed health measures, or DHMs, we heard about them all throughout the pandemic, but they have been around for much longer. I asked the Douglas County Health Department how many of these DHMs are issued every year. The answer: 50 to 75 times a year, and many times the general public has no idea about them. I'm told by the health department that most often the DHMs ask people to isolate or quarantine for spreadable diseases like TB, whooping cough, salmonella, mpox, formerly known as monkeypox, and most recently in Douglas County, an outbreak of hepatitis A. Let's hear from both sides of the bill, starting with the senator who introduced it.
Under LB 421, public health directors will serve as advisors to the elected officials who oversee their department. The public health officials will present their case regarding the need for a directed health measure, their rationale and evidence, and recommended guidelines for implementation. Their contribution stops there.
I think it is clearly going to introduce significant delays in our ability to take those steps to protect our citizens. And I think it undermines the credibility and the authority of our local health officials to be able to do that.
The Douglas County Board of Health has an official position in opposition to the bill. Omaha City Council President Pete Festerson also signed the letter in opposition. Reporting live from the newsroom, Bella Caracta, 6 News.